For 116 years, Mount Carmel has been providing world-class healthcare. In that time, they've grown into one of the largest healthcare providers in Central Ohio. With over 8,600 employees, 1,200 physicians, and 1,300 volunteers, Mount Carmel wanted to continue providing the compassionate and loving service they were known for. But financial hardships caused them to pause and reconsider how they were going to sustain the business long-term without sacrificing quality or customer satisfaction. The management team knew short-term cost-cutting was not the answer, so they looked to Six Sigma to help them build the passion for doing it the right way.
Up until this time, we couldn't find any organizations that had done this, so we were sort of out there by ourselves. But we soon learned that processes are processes, and regardless what business you're in, whether it's manufacturing, healthcare, education, government, that this could be applied.
This would be a solution to help our financial challenges that we were having, but we knew all along that the methodology would work projects that were critical sources of customer dissatisfaction. But in the same notion, we were really looking for a solution that would help us to remain financially solvent and ahead of the curve in healthcare.
Shortly after figuring out that Six Sigma was the answer, they needed to find a provider to implement the program. BMG quickly rose to the top.
One of the things that was exciting for us is none of us knew what we were doing, so we relied heavily on Breakthrough Management Group to lead us through this initiative, and they did a fabulous job.
Soon after the training began, projects were started throughout the hospital and results came almost immediately.
I recall a very early project that we had, and they were doing a flow diagramming process, and one team member said, "Well, that's something that you do." And the team member across the table said, "Well, no, that's what you do." And it was a big black hole. That big black hole was about $2.2 million worth of losses for our company that we were able to identify by just bringing the right people to the table and having the team members involved, talking to one another to resolve the business problem. So those are things that are tangible in the sense of the outcome of the project, but intangible in the way of relationships and bringing people together to solve common business problems.
As Mount Carmel's success blossomed, so did its partnership with BMG. Today, Mount Carmel relies on BMG's program management software to monitor Six Sigma performance.
We're moving to a web-based platform to track our projects really across Trinity, because there are other organizations in our larger family of Trinity hospitals that are beginning Six Sigma training. And this will now allow us to share our projects and results basically coast to coast once more member organizations take on training. And so we'll use a web-based product called Projects.
BMG is growing and staying really kind of ahead of our needs. We've had the opportunity to benefit from them having a very visionary approach to the way that they provide services to their customers.
But the biggest benefits of implementing Six Sigma were
getting everybody on the same page, looking introspectively at ourselves. When you're dealing with people's lives and their emotions, it's important we do the best job we possibly can.
We have actually implemented solutions versus just coming up with those solutions, and we've been able to experience the long-term sustainable results, and I think that's the biggest differentiator in the healthcare organization.
Just in terms of bottom line and top line, our net profit, $30 million plus over the past 3 years.
The long-term goals of using Six Sigma were not only professional, but also personal.
If I can leave any sort of stamp, any kind of a legacy of any sort, it would be to help healthcare across the United States. The more organizations in healthcare that can learn and understand these concepts as a business management system, concepts around variation in every process, entitlement of a process, what we really could do, not what we're actually currently doing, but what a process is capable of doing, that eventually will change the face of healthcare.
I'm not real sure that we can, honestly say that we've made the full cultural transformation. We have many things to do, and we're excited about that. I can tell you we're in a very different place than we used to be 3 years ago, and we're making great progress.
Mount Carmel Health, another BMG Six Sigma success story.